1 in 4 Dutch people will face a form of mental disorder at some time during their lives. Fortunately, treatment of most cases is fairly straightforward. However, some clients' conditions are more serious, and each year 18,000 separations take place in Dutch mental health care facilities. Placing a client in separation is a last resort for both the client and the caregiver. Research indicates that on average a client placed in separation spends twice as long in a mental health care institution. This can lead to traumatization of the client and demotivation of the caregiver due to feelings of powerlessness and increasing healthcare costs for the institution and the government. Philips doesn't only care for those with physical medical conditions, we also care for people with mental issues. Therefore, we're researching ways in which the number of psychiatric patient separations can be reduced. Together with Dutch mental health care institution GGZE, we began researching alternatives for separation. Years of successful ambient experience implementation has shown that dynamic light, sound and projection can have a positive effect on anxiety and stress. Combining this knowledge with the extensive field expertise of the GGZE caregivers, as well as the findings of actual clients, we jointly developed the Ambient Experience for Mental Health Care concept. GGZE is the world's first institution to install this innovative prototype in its high care unit. So let's take a tour. Prior to a potential escalation, the client and caregiver sit down in the intake room. Here they agree on a process that is intended to return the client to a calmer state. One step in this process is the selection of one of the many ambient experience themes, in which we strive to provide control and distraction, reducing stress and discomfort. On the way to what is known as the support room, the client enters a hallway with dynamic cove lighting, and this suggests a gentle beckoning motion. This way the caregiver may avoid excessive coaxing of the client to the support room. When entering the support room, the theme already selected in the intake room transforms this room into a multi-sensorial experience. Now, the rounded corners are designed to make the room appear larger, and the floor is divided into 2 colored zones. There's the public space and the private space. Now, all these details are designed with the aim to give the client a safe and secure feeling. The support room's main asset is a large interactive wall. Its multi-option screen can display nature scenes that may reduce stress levels. And when the client is more responsive to stimulus, he or she can engage in activities that are aimed at supporting recovery and helping in analysis and treatment. For example, some of these features are reading, doing puzzles, or even video calling with a caregiver or family member. With this new care concept, Philips and GGZE will investigate if separation rooms, as we know them today, can ideally be replaced by these kind of support rooms in the near future. But until that time, we are continuing our research into this newly entered area of health and well-being. We aspire to create optimal treatment solutions with the ultimate goal to reduce the number of psychiatric patient separations and increase the clients' and the staff's well-being.